Welcome back to another edition of Dr. Twyman's Ask Me Anything. Hope you guys had a great Christmas, holidays, Festivus, whatever you like to celebrate, and are getting ready for the new year. So, got some great questions tonight, so we'll jump on in. So the first question tonight, can arrhythmias be stopped by naturally diet and lifestyle rather than drugs and or surgery? The answer is possibly. It really depends on what the rhythm issue is. If it's a premature atrial contraction, premature ventricular contraction, possibly supraventricular tachycardia, you might be able to do it with just lifestyle alone. If it's AFib, a little bit more difficult. There's another question about AFib coming up that I'll give you a little more details on. You first want to figure out, is there a known trigger? So is there a certain environment that you're in that drives it? Some people are very sensitive to non-native EMF. So not the only reason that I wear a mechanical watch, but I've definitely seen patients who have the smartwatches have more and more palpitations, and the second they take the watch off, the palpitations go away. So look at your environment. Then there's a whole host of biomarkers you can check to see if you have optimal nitric oxide levels, where are your omega-3 levels, your magnesium levels, and thyroid. Those are probably the top things on top of my mind. If you fix those, don't necessarily need to go down the route of drugs and surgery. Question, why does the GLP-1s lower blood pressure drastically? I've not actually seen that clinically. I have many patients who have other providers that have prescribed them GLP-1s. I would suspect it has something to do just with the weight loss. As you lose weight, for every about 20 pounds of weight you lose, your systolic blood pressure should drop by about 10 points. But the GLP-1s do help the endothelial function, and they do potentially increase nitric oxide. So that's probably the mechanism of action, how it would have an effect on blood pressure. Question up about insulin sensitivity or insulin resistance, how to fix it. So this is kind of a complex topic because insulin resistance isn't one thing. I was at the A4M conference recently, and Peter T had talked about it. There was a concept of I'll forget the name of it, exactly how he said it, but it was basically it's like the horrible eight or something like that. It's like the 8 different organs and how insulin resistance affects them. So insulin resistance, mainly people are thinking about it as skeletal muscle, liver, and fat cell. But insulin resistance is not necessarily bad for you. That's kind of counterintuitive. It would have been useful for you to be insulin resistant in the winter and store fat for energy. But if you're trying to reduce it, always look at your skeletal muscle first. Your muscles handle about 80% of your glucose load. So strength training, exercising shortly after meal times to kind of use the non-insulin dependent pathways to push the glucose into the muscles is useful as well. And then a whole concept of circadian biology, entrainment. Insulin is a solar hormone. So if you're getting the wrong light signals, you're going to release insulin at the wrong time. So the key is block your artificial light and get proper sun exposure on your surfaces. Is ApoB and LPLA expected to increase on a ketogenic diet? Not necessarily. Everybody has a different response. May be more common in patients with ApoE4 alleles. Is it safe to continue if you feel great? Again, depends on the health of your endothelium and your intima, and if you have any plaque in your arteries. So yes, many patients feel better on carnivore keto diets, but you have to look at what is the vascular effect of that. So if patients say, I feel great, I don't ever want to switch, okay, what are you going to do to modulate your ApoB, your endothelial dysfunction? Are you willing to take pharmaceuticals, yes or no? So you usually can help people, optimize their vascular risk, but sometimes it's better to kind of dial back on the ketogenic diet, particularly when it's not in season. If it's summertime, it doesn't really make sense to eat a keto diet in the northern hemisphere, and then maybe transition into it only during the wintertime. Do I recommend supplementing with ubiquinol while on a statin? The answer is potentially. I tend to more shoot for having CoQ10 serum levels greater than 3. Somebody's asking a question about blood oxygen. So why does their blood oxygen get low during the day? Theirs can get down to 90 with my MVD. I'm not sure exactly what MVD stands for. There's a couple things that it possibly could be. First, make sure you actually have an accurate pulse oximeter. Are you symptomatic? Do you actually have known, lung disease? Do you have a cardiac shunt? Are you anemic? There's a lot of things that would need to be known to understand why exactly the pulse ox is getting low. Would you help manage lone AFib for your patients? This is qualified, possibly. I'm very comfortable taking care of atrial fibrillation. I've taken care of thousands of cases in my career, but I don't tend to focus primarily on arrhythmias at this stage of my career. I'm more focused on vascular health, endothelial function, nitric oxide, lipoproteins, atherosclerosis. That's kind of really my wheelhouse right now. But I can't help people with lone AFib. Again, it's often an issue with something affecting microvascular disease. You have endothelial dysfunction, you have oxidative stress, you have inflammation, you have a thyroid condition, you have electrolyte imbalance, you have a 4Q25 gene. So sometimes I can get to the root cause of it. You have sleep apnea, for example. Then we can kind of talk. But if patients are interested in using antiarrhythmic therapies or potentially going on to having a procedure, I'm not that guy. I have friends in the area that I can refer people on to if need be. Do I target certain omega-3 index values for my patients? Yes, I do. I check them in pretty much every single patient. Depends which lab. Cleveland Heart Lab and Boston Heart Lab have panels with different reference ranges. I generally like to see an omega-6 to omega-3 ratio of 0.25 or greater. It's probably more important to know about that ratio than just the omega-3 index. Good question coming up. After an in-person consultation, can someone remain a patient of my practice remotely? The answer is yes. In the new year, we're going to do it a little bit differently. Nothing drastic, but right now, the majority of patients that work with us do what's known as a 2-part deep dive. The initial visit is in St. Louis. That is so that we can, one, meet you in person. As much fun as it is to meet people virtually, meeting somebody in person, you actually can sample their quantum fields essentially, and you then also have access to all our non-invasive cardiovascular testing. So instead of trying to bounce around to multiple different offices, clinics, hospitals, head to toe, we can screen you. The only thing we don't do is a CT scan in office. We can send out advanced lab work through either Boston Heart Lab or Cleveland Heart Lab, and then if needed, genetic panels. Sometimes it takes up to 4 to 6 weeks for some of the labs to come back. Once results are back, then we have a second part visit that can either be done in person in St. Louis or remotely via Zoom. That is an hour-long appointment. We go over all your results. And at the end of the appointment, you have a written wellness plan that tells you, if we should tweak something in your lifestyle, optimize something in your supplement regimen if you're on supplements, and if you're on pharmaceuticals, based off your genetics, which pharmaceuticals would likely work best for you. And at that stage, you're free to take that information and work with your local primary care doctor, or if you have a cardiologist in another state, you can work with them. If you are asking us to continue to manage any medications, or you want us to continue to check labs for you, Then we're going to have a new program for people starting in 2025 where they can kind of have a more scheduled follow-up at 4, 8, and 12 months. So be on the lookout for more information about that. I'll release it somewhat in my Instagram, and then while I know I've been very lax in doing any newsletters in the past few months, I do plan to start writing at least one newsletter a month to my list with updates about how the practice is working and any good educational resources I come upon. Next question, is there a connection between artery health and osteoporosis? There actually is. If you have osteoporosis, it is a risk factor for coronary atherosclerosis. Think about it in ways that if you're pulling calcium out of your bones, that calcium is going somewhere. So if you have a history of osteopenia or osteoporosis, a test that you should consider if not done before, if you don't have known vascular disease, is a CT coronary calcium score. If your calcium score is over 0, your risk is increasing, and you need to get to the root cause of what other risk factors you have other than osteoporosis. Vitamin K2 is an important vitamin for calcium metabolism. It helps keep the calcium in the bones and prevents it from building up in the vascular system. And then the last pre-submitted question. Somebody says that they have Sjogren's syndrome and mixed connective tissue disease and a calcium score of 306, which is in the intermediate to almost high risk zone. Anything over 400 is high risk. What do you need to know? Well, autoimmune conditions increase risk of vascular disease because of the chronic inflammation. The glycocalyx of the lining of the arteries gets damaged by the inflammation. The underlying endothelium becomes impaired. Then lipoproteins get retained in the intima, cause intimal swelling as more inflammation occurs in the arteries. More and more cholesterol gets deposited into the artery walls. It's like having a splinter. More and more inflammation occurs, and then you start developing plaque in the system, in the vascular system. The body then starts forming smooth muscle over the plaque and eventually may calcify the plaque. And that's what got picked up on the calcium score test. So you got to get to the root cause. Other than autoimmune issues, what is driving this process, and pull back on those levers. All right. So those were the pre-submitted questions. I see a few questions in the comments. How fast does heart disease progress? It's a great question. Faster than you imagine, but most people are not doing serial testing, which would look at things. So most people are only doing some type of imaging test, once a year or so. But definitely have seen it, in my days prior to doing things I do now. Patients would get a stent in the cath lab, and while they may just be on a statin, an aspirin, if they didn't fix their endothelial dysfunction or really keep inflammation low, we'd see them back in the cath lab in less than 6 months. And lesions that were, 30% stenosis, a few months before, they can be 70, 80% in just a couple months. Somebody says, should they be concerned if their blood oxygen on their Apple Watch is consistently between 80 and 90? The short answer is unknown. While those devices are generally calibrated, they're not, medical devices per se, even though they may have an indication to, assess, your blood oxygen level. I would not, bet anything on it. If it's abnormal, I would use an actual pulse oximeter or, have it checked at the, your physician's office, or if you're, feeling poorly, if you're at a, urgent care ER, they'll use the right equipment to see, is your Apple Watch actually accurate or not. Well, best time of day to take Vascanox, early in the morning, 2 tablets. Any circadian component to it? No, not really. And does it have effect on exercise performance? Yes, it improves it. You may have an increased VO2 max with it. Okay, so somebody said earlier, the question about the low oxygen and the MVD, microvascular disease. So that's why I suspected to be. There's also a mixed connective tissue disease that is similar to that. And then there's a couple other infectious disease. So I was just making sure. But again, if it's from an Apple Watch, I don't think I would necessarily trust it. I'd want to see it on a pulse oximeter. All right, this is a I can only speak in generalities. I can't give direct medical advice unless you're one of my patients that I'm seeing in my office. But somebody's asking about chronic pericarditis for over a year after having open heart surgery. This is not an uncommon side effect from surgery, unfortunately. If the person has already tried, non-steroidals and colchicine and still having recurrent symptoms, there is a new drug on the market. The name off the top of my head escapes me because I've never prescribed it. I've only seen one patient potentially use it in the past. If they've already gone through that round, then yes, potentially a pericardectomy might be beneficial. All right, so it says they just got here. Thoughts on nattokinase? Usually neutral on it. I mean, it may help with lowering fibrinogen if fibrinogen's high. Bioavailable turmeric, depends. If you have elevated hsCRP, possibly. But know that turmeric is going to have an effect on how well your body makes melanin. So if you have issues with melanin, you don't want turmeric on board. And then grapeseed extract for glycocalyx support. Some of these supplements do have that in there. It helps with just reducing oxidative stress. What about pulsed EMF for microcirculation? Not a fan. Go read Andrew Marino's book, Going Somewhere. Go read Dr. O. Becker's book, The Body Electric. EMFs are not to be messed with unless you know what you're doing. Pulsed EMFs can induce cancers in certain situations. They may be beneficial in others, but the person who's usually recommending to you doesn't know those things. So buyer beware with pulsed EMF. I've tried it before. It may be relaxing, cool, but you don't know about the damage that you might be doing to the mitochondria with it. So kind of a general point, is a form of glutathione a good supplement for heart health? Glutathione is the body's master antioxidant. You generally do not want to be supplementing something if your body can produce it. If you're truly low in it, you got to figure out why is your body under such oxidative stress. A lab test you can assess is GGT, gamma-glutyl-transferase. If your GGT levels are high on your serum testing, then you have low glutathione stores. Oftentimes it's better to support it with cysteine, which is a precursor, and then the body makes the amount of glutathione it needs. If you supplement directly with glutathione, you're going to downregulate your body's production of glutathione, and eventually make it to the point where your body can't produce enough, so you're going to always have to supplement at that stage. Okay, so somebody says that they did do the Retanercept, so for the pericarditis. Unfortunately, if that and colchicine NSAIDs haven't worked, then you definitely would have to talk to the surgeons about doing a pericardial procedure. All right. I think those are the questions at the moment. I'll hang on for another minute or so. So to wrap up, hope you guys had a great, Christmas, holiday, Festivus, whatever you like to celebrate. In the new year, Apollo Cardiology is going well. We took over a space next door. I have a studio starting to be kind of laid out there, and then that's where we're now drawing labs for our Apollo patients. Haven't acquired any new pieces of gear recently for Apollo, but have some in mind that might be assessing the glycocalyx a little bit differently. And then I've been looking at a device that can look at your retinas and look at the retinal age. So thinking about potentially upgrading some of our gear at the practice. talked about it a little bit earlier, is that right now, our practice is not full, but if you're on the fence about potentially wanting to see us, I don't think I would wait too much longer. We're booking out a few months at this stage. We had nearly 200 new people fly literally across the world. We've had people from Australia, Dubai, Canada this year, and then almost every state. So if you're interested in working with us, we still have availability. Go to my website, drtwyman.com, and there's an application, and then my team will set up a Zoom call with you and make sure that we're kind of a good fit for you. If you're interested, we'll get you squared away, and we'll get you set for one of those deep dives. After the second part of the deep dive, if you're interested, you can take your information and take it back to your local doctors. Or if you want to continue to work with us, we're going to have a new plan for new patients starting 2025, where there's like a continuity program for a year. It'll include, at least 3 visits with us. The final visit of the year will be an hour-long visit. We'll update all the things we need to from a lifestyle standpoint. So optimize your circadian rhythms, your sleep, your stress management, your nutrition, your exercise. We'll tweak your supplements as needed. And then if you're on pharmaceuticals, we'll make sure you have 90-day refills with a full year supply. So if you're interested in that, take a look at my website. So hope you guys have a great New Year's. I'll be back next Monday, 6 p.m. Central Time.